Hi everybody, this is Dr. Mac from Energize Physical Therapy. Today's topic we'll be talking about is stroke. More scientific, it's called cerebral vascular accident. We'll be going into not exactly why you get a stroke, but what happens after and how physical therapy will help even after you go through your physical therapy in the hospital. A lot of people may think after you get the stroke, you go through therapy, and then after you go through therapy, you're sent home, and whatever improvements you made there is the maximum improvement that you can make. That is not true, and that improvements can be made, and we'll go into further, what kind of improvements. Going into the concept of having a stroke, what happens after is usually majority of the times you get one-sided weakness, either the legs or the arms, and you may have difficulty walking. You may have to use a cane, a walker, be in a wheelchair. So everybody presents differently. That will usually last a couple of weeks. When you're sent home, some people still have difficulty walking. Some people still lean more on one side than the other. Some people cannot walk as far or cannot lift or hold up a glass. Those are just some of the difficult things that people still find after they're sent home. Studies actually do show that even after you suffered a stroke, that the brain is actually ever changing, so it never stops changing. The nerves and the cells are constantly firing and molding. It shows that physical therapy, even after you had that time period with rehabilitation, that there can still be changes made. Strengthening is very good for individuals that have suffered a stroke. Depending on how severe the stroke is, you may not be 100% back to normal, but they still say changes can be made and you can get stronger. You can walk faster. You can walk better. There's still opportunities for improvement and room for improvement. Don't forget this. For family members or friends that you know, or even yourself that has suffered such an incident or experience, 5 years after the incident, 6 years, 10 years, still you can make changes to the body, right? You can still get stronger, you can still walk better. So it really depends, how severe the accident was. Take-home message of this is that neuroplasticity, or changes molding to the brain, is still going on, no matter if you had an accident, a stroke, if you had a traumatic brain injury, if you had spinal cord injury, like any changes like that, your brain is still changing. If you feel like somebody needs that therapy, you can always ask them to refer to a physician, healthcare professional, or a physical therapist to go for an evaluation to see what kind of improvements are to be made. And if you really have goals that are feasible, that is achievable, we'll try to help you get to that. If you have any questions, you can leave comments below or give us a call. Again, this is Dr. Mac from Energize Physical Therapy. Thank you. Bye-bye.